Welcome to AETCM, the Emergency Medicine channel. So today I'll be discussing about the drug Bupivacaine. So it's mainly used in ER, most commonly for as a local anesthetic or in peripheral nerve blocks. So that is the most common use case scenario in ER. And coming to the classification of Bupivacaine, so it's actually a long-acting local anesthetic. So basically it comes under the group amide group. So basically we have two kinds of local anesthetics are based on the structure. We can divide it into amides and esters. Amides and esters. So these are the basic two classification of local anesthetics, and then based on the duration of action we can further divide it. So basically the amide groups are the ones which we commonly use, which includes bupivacaine, lidocaine, and then other drugs like prilocaine and all is there. Whereas in esters there is basically the benzocaine, cocaine, or the procaine. All those drugs will come under ester group. So in amide group, long acting, it is bupivacaine. So that is the classification. So the mechanism of action. So mechanism of action is basically it inhibits all the nerve impulses. So basically it inhibits more of sensory action than the motor action. So the sensory nerve impulses are inhibited more. So basically it blocks the initiation and conduction. The initiation and conduction of these nerve impulses. So how does it occur? So it occurs basically by changing the permeability, that is the neuronal membrane, the nerve membrane permeability is changed. So the sodium channels are blocked basically. So there are voltage gated sodium channels in the neuronal membranes. So the voltage gated sodium channels are there. So there is voltage gated sodium channels. It inhibits the opening of these channels. So the neuronal permeability to the sodium ions as well as the channels are blocked. So there won't be any sodium influx. So this will cause cause inhibition of depolarization. So that will be the reason for the inhibition of the nerve impulses. So there is inhibition of depolarization. So that is the basic mechanism. The neuronal permeability to sodium ions is basically altered, and there is inhibition of this voltage gated sodium channels. So there is no sodium influx causing inhibition of the depolarization, and this inhibits the conduction of the nerve impulses. That is a basic mechanism of action. Coming to the pharmacokinetics. So how is it? So the onset for what we give usually is infiltration. That is that has fast onset of action. So it has fast onset of action, whereas for epidural and spinal there are spinal it is 1 minute, whereas epidural it is 17 minutes. And coming to the duration, epidural it is around 2 to 7.7 hours, and for spinal it is around 1.5 to 2.5 hours. For us, infiltration, that is it takes basically 2 to 8 hours. So it is important we know regarding the duration also of the infiltration dose. It will be 2 to 8 hours. And coming to metabolism, it is mainly metabolized in the liver. So there is hepatic metabolism and is excreted via urine. So this long duration of action of this bupivacaine is basically because of the increased plasma protein binding. So the plasma protein binding is increased, so that is why the duration of action is on the longer side. The lidocaine which we use is usually intermediate acting local anesthetic. So coming to the uses and doses. So basically what is it used for? It is used for our usual anesthesia or analgesia effects. So that is the only use case scenario. So where all we use it? We use it as most commonly in here, as we said, we use it for local anesthesia or for peripheral nerve blocks in case of any open fractures. In those cases, to give nerve blocks, we can use bupivacaine, as it also has a longer duration of action. And then in other case scenarios in anesthesia and all, they use it for epidural, spinal, caudal blocks and all, central nerve blocks. Basically, they use bupivacaine also. So coming to the dosages. So this is the only use case scenario for bupivacaine, and as I said, the sensory is blocked more than the motor component. So here in infiltration, so we actually the ampule is has a concentration of 0.25% is available, 0.5% is available, 0.75% is available. So what is it actually meaning? So if it is for example, if we take an ampule of 0.25%, it will be around 0.25 grams in 100 ml. So this will equate to around 250 mg in 100 ml. So that will be in 1 ml, how much will it be? It will be around 2.5 mg. So in the same case, if you apply it for 0.5 percentage, which are the two most common dosages we use. So in 0.5 percentage, we get it around 5 mg. This is mg, 5 mg in 1 ml. So that is clear. So this is the per ml dosage of bupivacaine in that ampule which we take of bupivacaine. So it is 0.25 percentage and 0.5 percentage is the most commonly used one. So for infiltration purpose, we can use 0.25 percentage. So based on that, the maximum dose in mg we can give is 175 mg. So if you calculate approximately for 175 mg, approximately it will be around 70 ml. So 70 ml will be the maximum you can infiltrate locally in an adult individual. So but if you take it for in the case of a pediatric population, in pediatric population we have the mg per kg dosage. So the 0.25 percentage bupivacaine will be giving maximum of 2.5 mg per kg, or we can give maximum dose of 150 mg, a little lower than the adult dose 175 mg. So 150 mg will be the max dose we can give. And then coming to the other blocks, the epidural block, the caudal blocks, there are ml concentration we can give, that is 10 to 20 ml for epidural block of 0.25 or 0.5 percentage we can give. In pediatric case, we can give. So in pediatric case, we can give less than or equal to 0.25%. There is also available concentration of 0.125. So the half of 0.25 is also available. So less than or equal to 0.25 percentage we usually give, and in that we can give ml per kg dosages given here 0.7 to 0.75 and 0.3 to 0.6. That is basically based on infants and children. This one is for infants less than 1 year age group, and for children 0.3 to 0.6 we can give. Okay, 0.07. So 0.3 to 0.6 ml per kg in children. Maximum dose we can give is 2.5 mg per kg, same as the infiltration dose. And coming to the caudal, this one is the epidural for pediatric dosage epidural block. And for caudal blocks, we will be given 15 to 30 ml of 0.25 or 0.5 percentage, and that it will in pediatric dose it will come around 0.5 to 1.3 ml per kg, and max we can give us 20 ml. And if you take it on the basis of mg per kg, and one more thing which I wanted to say was it can be available as a plain bupivacaine, or it can be available with adrenaline. So it can so basically with adrenaline, what we all know, it helps to prolong the duration of action. So the absorption into the systemic circulation is delayed because it causes local vasoconstriction. The adrenaline causes local vasoconstriction and it delays the absorption into the bloodstream. So it has multiple advantages as well when you mix it with adrenaline. So it decreases the bleeding, it prolongs the duration of action and decreases the systemic toxicity. So you can give it a higher dose of bupivacaine. So that thing also we need to know. And without adrenaline, the max dose will be 2 mg per kg or 150 mg. With adrenaline, it will be 3 mg per kg or 200 mg. Can give a higher dose. Okay, so that is basically the max dose for caudal blocks. When you take peripheral nerve block, this one is important in ER. Peripheral nerve block and infiltration. In peripheral nerve block, we will give around 5 ml. So we can take again 0.25 or 0.5 percentage, and we can give around 5 ml of those concentrations. And the maximum dose we can give is up to 400 mg per day. So that is the max dose we can give. And then coming to the pediatric dose, we have 0.125 to 0.25 percentage bupivacaine we can use, and that ml per kg dosage is 0.05 to 0.5 ml per kg. And that also max dose is same as I said earlier, 2 mg per kg or 3 mg per kg based on with or without epinephrine. Then sympathetic nerve blocks also we can give, that is higher ml is required, 20 to 50 ml of 0.25 percentage is required, whereas spinal one we give it as an infusion, or we can give it as a loading dose infusion, like that we can give. So that we usually mix it with dextrose. So that is available as we can get ampules which is already mixed with dextrose. So here we can use a concentration of 0.75 percentage in 8.25 percentage dextrose, and we can give around 0.8 to 1.6 ml. So that is basically the dosage. So the main thing we need to know is the infiltration dose, which is 0.25%. We can give maximum 175 mg. Pediatric we can give around 150 mg or 2.5 mg per kg. Okay, so that is clear. And peripheral nerve block is what we need to know. So that is 5 ml of the 0.25 or 0.5% bupivacaine, and max dose we can give at a higher limit. It is 400 mg per day. Whereas pediatric dosage also we use 0.125 to 0.25%. Concentration we will give in ml per kg dosage, which is 0.05 to 0.5 ml per kg. So max dose for those also we have to know 2 or 3 based on with or without epinephrine. So that is basically what we need to know in dosage part. Then coming to the adverse effects, basically the common adverse effects can be some pruritus or rashes can be present, in this, itching and all can be present at the site of injection, or there can be some GI effects, like there can be nausea, vomiting, constipation, like that side effects can be there. And then in CVS wise, there can be a depression. Basically it is more seen with IV loading doses or infusions, and less seen with local anesthetics. So there can be myocardial depression if you give at a higher dose. So this one you need to know, myocardial depression. So it will cause what all will it cause? It will cause everything will decrease. So it will cause hypotension, it can cause bradycardia, it can cause heart blocks, it can cause arrhythmias. So those all things can happen with bupivacaine. And then CNS also it can cause CNS depression, but initially there might be a stimulant effect as well. So initially there might be a stimulant effect, so the patient can have anxiety, or patient can have restlessness, seizures, agitation. So all those hyper activities can be there, and it will be followed by CNS depression. They can become drowsy, they can go into coma, stupor, coma. So all those things can occur with bupivacaine. Then other side effects, like some pronounced side effects are tinnitus. Tinnitus can occur, or the usual ones which is there with every other drug, like the hypersensitivity reactions. So all those things can occur with bupivacaine. So it's just a short topic, and these are the things you need to know basically with bupivacaine. Hope you have understood this session. Thank you.